In this section now, which is the second section of our lecture, we will discuss the obstetric hemorrhage. The common causes of obstetric hemorrhage which we will discuss in this section are abruptio placenta or placental abruption. Both are used for abruptio placenta is also used for the placental abruption. Then placenta previa and then vasa previa. All these are the common causes of obstetric hemorrhage, and then we will discuss them today in this section. First, the abruptio placenta or placental abruption. If you see in this diagram, this is the placenta, this is the lining of the uterus here, and this is the blood. So what happens with the abruption of the placenta? There is a separation of premature, early separation of placenta from the lining of the uterus, and as a result of that, there is blood in the uterus. So abruptio placenta, premature separation of placenta from the uterine wall. Placenta is normally attached to the uterine wall, and in the third stage of the labor, after the baby is delivered, then the placenta is delivered. But when it's prematurely separated from the wall of the uterus, it's called abruptio placenta. The risk factors include hypertension and preeclampsia. High blood pressure is associated with abruptio placenta. Trauma or use of cocaine can cause abruptio placenta also. Polyhydramnias, when there is excessive amount of amniotic fluid present, which is polyhydramnias, it can also lead to abruptio placenta. Multiple pregnancy and fetal growth restriction. If there is more than one fetus, multiple pregnancy, it can also cause abruptio placenta. Smoking, if the mother smoke, it can cause abruptio placenta. Smoking also cause hypertension, preeclampsia that can be associated with the abruptio placenta. And then it's also cause a smoking placental abruption. So these are some risk factors or causes of abruptio placenta. Warning signs of abruptio placenta are the maternal collapse. If the mother collapses, if there is hypovolemia, if there is hypotension and mother collapses, that's the warning sign of abruptio placenta because of the hemorrhage. Cold or dizziness, if the mother is cold and dizzy, that's the other warning sign. Distress and panic. Restlessness and vaginal bleeding. If there is bleeding from the vagina, it can be due to abruptio placenta associated with collapse, hypotension, distress, panic attacks. These can all cause the abruptio. These are all the signs of abruptio placenta. This is the hemorrhage. This is the picture of the hemorrhage, which is revealed hemorrhage. The hemorrhage can be revealed when no blood is coming out of the cervix or vagina. That's the revealed hemorrhage. Concealed hemorrhage, if the blood is coming, that's revealed. If not coming, that's concealed. So it's opposite. Concealed is when no blood is coming out of the vagina or the cervix. This is concealed hemorrhage. It stays in the uterus, but when it comes out of the cervix, it's called the revealed type of hemorrhage. Clinical presentation of the patient, no correlation of vaginal bleeding with degree of abruption. So if the blood is coming out of the vagina, Just by looking at that blood, you cannot tell how bad is the abruption or how bad is the condition. So just by looking at the blood, you cannot correlate it with the degree of abruption. Painful bleeding occurs sometimes. There is rigid abdomen. Peritonitis occur if there is bleeding inside. This causes rigidity and the abdomen becomes very rigid and painful when you press or palpate. Management based on clinical findings, and then if these cardiotocograph shows the fetal distress, then we should manage according to that also. So on the patient, usually the patient present with the first indication, it might be a blood coming out of the vagina if it's a revealed type of hemorrhage, but that blood is not the indication of the seriousness of the condition. And then here, this is the normal, this is the placenta, this is the wall of the womb or uterus. Abruption has come away from wall of the here, the placenta is abrupted. So the management depend on the clinical findings. Abdomen can be very rigid and painful. Another condition is placenta previa. Placenta previa, as the name shows, this is the placenta is low-lying. Placenta is not in its normal location. It's low-lying placenta, and that placenta can cause bleeding and hemorrhage. In this placenta previa, the placenta covers the cervical os or cervical opening. This is the normal placenta. This is the placenta which is low-lying, but it's not covering the cervix. This is partial placenta previa. It partially covers the cervix. Here, this is the total placenta previa. The placenta covers the cervix completely. So, different types of placenta previa. Placenta is low-lying. If it partially covers the cervix, that's the partial placenta previa. If it completely covers the cervix, it's the total placenta previa, and then placenta covering the cervix. Bleeding may occur provoked or spontaneously. It can be actually provoked by handling, or it can occur spontaneously. Avoid non-clinically indicated C-section. If there is no indication for C-section, avoid the C-section in case of placenta previa. Risk factors include multiple pregnancies, multiple gestation, twin pregnancies, uterine structural anomaly. If the structure of the uterus is abnormal, that can prevent the placental attachment. It's in its normal place, which is in the fundus, then the placenta is lying lower. Assisted conception, if some medicines are used for the conception, that can also cause placenta previa, and any previous C-section can lead to placenta previa. Here in this you can see the total placenta previa. This is the low-lying placenta. It totally, completely covers the cervix or the cervical opening here. This is total placenta previa. The warning signs of placenta previa: low-lying placenta, maternal collapse because of the hemorrhage, coldness and lightheadedness, painless bleeding, distress and panic. These are some warning signs of the placenta previa. Clinical presentation, how the patient will present: painless vaginal bleeding in abruptio placenta. there was pain, abdomen was painful, and in this case there is painless vaginal bleeding. Abdominal pain is present, and there are uterine contractions. Uterus is contracting. Preterm labor can occur in patients with placenta previa when they start bleeding. Diagnosis is by the ultrasound, very commonly, which is transvaginal ultrasound, and then measurement of placental edge from internal os, looking for where the placenta is, how far it is from the internal cervical os. That gives the idea whether it's placenta previa or not. Anomaly scan in low-lying placenta. If the placenta is low-lying, we should do the anomaly scan to look for any fetal abnormalities associated with low-lying placenta. Management is symptomatic management, and fetal and maternal monitoring should be done constantly, might call for immediate delivery. Clehart test, administration of anti-D immunoglobulin, and antenatal corticosteroids can be used. So all these are the management steps in patient with placenta previa. The third condition which can lead to obstetric hemorrhage, besides we went over the placental abruption, which is the early premature separation of placenta from the uterine wall, placenta previa, which is the low-lying placenta, which can be partial or which can be total placenta previa. The third condition is vasa previa. Like placenta previa, where the placenta is not in the normal place, vasa previa. Vasa is the term used for vessels, blood vessels. So in this, the blood vessels are involved. Occur when fetal vessels transverse the fetal membrane over internal cervical os. So in this, the fetal blood vessels, they transverse the fetal membrane. Fetal membranes, chorion, amnion, they are transverse or crossed by the fetal blood vessels. That's the vasa previa. Vessels form velamentous insertion of umbilical cord and joining accessory placental lobe. So these vasa previa, which is the when the fetal blood vessel transfers the fetal membrane in the cervical or over the cervical os, they form velamentous insertion of the umbilical cord. Umbilical cord is inserted by the vessels, and there is accessory placental lobe formation. Membrane rupture, there is bleeding, and this can lead to the diagnosis of vasa previa. Perinatal mortality from fetal exsanguination. Though perinatal mortality is common in this condition because the fetus is affected by the involvement of the fetal blood vessels. That's all about the causes of obstetric hemorrhage, in which we talked about 3 very common causes that can lead to obstetric hemorrhage and obstetric emergencies. Thank you for watching sqadia.com.